On behalf of the Inpatient Wound Department, welcome to Erlanger. Our mission here at Erlanger is we compassionately care for people. And isn't that why we're all here, is to take care of our patients? Our goal as inpatient wound care is to come alongside of you and provide excellent care for our patients. So our discussion is pressure injury identification and prevention. Our wound care department is Holly, Sherry, myself, Kelsey, Lydia, Allison, and Julie Brandt is our executive director. Best way to get a hold of us is to page us at 1205. You can call our extension and leave us a message, but we're only in our office a couple times a day, so we really prefer that you page us or that you put in a consult for us. And while we're talking about that, you do not have to have a doctor's order to put in a consult for inpatient wound care. Let's talk about hospital-acquired pressure injuries, something we really don't want to talk about, but let's discuss that. CMS does not pay for any stage 3 or stage 4s that we cause here in-house. And all of our wounds, of course, are recorded nationally, and they do affect our scores. It can increase our cost of care. And have we had lawsuits and settlements? Yes, we have here at Erlanger. Those have been very few, and the average can cost anywhere between $75,000 to $200,000 per year. What can help us prevent those hospital-acquired injuries? One way is documentation. Assessing our skin within 12 hours of admission. Tell us exactly what you see. We don't expect you to stage. Talk about what the wound looks like, the size. Chart if your patient is refusing to turn. Chart what you see, and please remove those dressings so that you can chart adequately. Again, do not copy and paste. We've had situations where that occurs, and it just can open us up to situations. So copy and paste your own, but do not copy and paste someone else's work. Braden Scale, very important, to be completed within 12 hours of admit, then every shift. The lower the score, the higher the risk. So if your Braden is 18 or less, then prevention measures should be implemented and documented. And this would include information like sensory perception, the moisture, their activity, their mobility, nutrition, and friction and shear all go into calculating the Braden score. Skin assessment, again, our bedside staff are excellent in that. When do you do it? Every shift, on admission, after wound care, when they've come back from a lengthy procedure, prior to discharge. Pay attention to the bony prominences. Those are the places where you will get pressure ulcers. So the back of the ears, the back of the head, the sacrum, the hips, the heels, those are the places where you will get pressure ulcers. Other areas of insult to the skin would be considered a partial thickness or a full thickness type of a wound. So what do you document? Document where is it, what size, what does the wound bed look like, the drainage, and what does the skin look around it? And note whether or not it blanches. We do not expect you to stage. We would actually prefer you not to stage unless you have been educated by the inpatient wound care nurses. Skin tears and skin folds. We see a lot of these. These are nurse-driven treatment. You do not have to consult inpatient wound care unless you've tried all the measures and you can't get anything to work for the patient. Skin tears. We can apply a Mepilex border weekly. We can apply Zeroform and roll gauze daily. So you'd use the Zeroform if it is draining quite a bit, and then change that daily. Otherwise, you can do a Mepilex border and change it weekly. Skin folds. Under the axilla, under the breasts, in the groins, you can contact your attending for antifungal powders or creams. The important thing here is to make sure that you clean these areas well with soap and water, pat them dry, sprinkle on the powder, or if you're using a cream, put on a thin layer of cream. It's not the adage where more is better. Is it pressure or incontinence? The $50 million question. So the pictures will show you there that incontinence is diffuse. It's scattered. It is everywhere. It's not over a bony prominence like pressure. So the pressure injury, again, is going to be more localized, more round, over a bony prominence. You can see the two, that's a great distinction there between those two pictures. Incontinent dermatitis can get really very painful here. You're seeing that these are red, these are open, these are very sore. So of course we're not going to be able to put a Mepilex dressing on these areas. More than likely we're going to use either Aloe Vesta antifungal cream, or we're going to use Desitin, those types of treatments for the incontinent dermatitis. And what is a pressure injury? According to NPUAP, a pressure injury is a localized damage to the skin and or underlying soft tissue, usually over a bony prominence or related to a medical or other device. The injury can present as an intact or an ulcer and may be painful. The injury occurs as a result of intense or prolonged pressure or pressure in combination with shear. The tolerance of soft tissue for pressure and shear may also be affected by the microclimate, the nutrition, perfusion, comorbidities, and condition of the soft tissue. So let's look at stage 1 and stage 2. Stage 1, intact, non-blanchable skin. If you were to press on that skin, it's not going to return a color for you. Partial thickness is a stage 2. It can be an intact blister, or like you're seeing there, a blister that has already been ruptured. Stage 3 and stage 4. So this goes back to our first or second slide where we talked about the possibility of these being hospital acquired and not being paid for under CMS. So stage 3 is a full thickness wound, possible slough. So the yellow that you see there in the top picture is slough. The bottom picture is a heel, so we don't have a lot of extra padding on our heels, so you can be to a stage 3 rather quickly. So stage 3, possible slough, full thickness. Stage 4, that is a knee there. Typically you're going to see bone, tendon, or muscle, and some slough. Pressure injury, unstageable, and deep tissue. So unstageable is a full thickness wound, slough obscuring the full depth. I can't tell you how deep that is, because if you were to touch that, that's going to feel real leathery. We don't know what the bottom of that wound looks like. But with good offloading, Mepilex, diligent care, a lot of times these can turn around or not be quite so bad. A deep tissue can look purple, red, non-blanchable. If you look in the center there, you can see how deep purple that is, as opposed to the unstageable, which can be more brown-black. So the deep tissue, again, purple. Now that peri wound might be able to blanch, it might not. Let's talk about wounds that are occur because of medical device related. So looking at those ET tubes, looking around our trach ties, checking the O2 saturation probes on the ear, alternating those sites, having respiratory come alongside of you and alternate where the ET tube is. Respiratory has also have some brand new masks that, if you'll look down at that CPAP mask, the one on the nose, we've had a lot of those occur. Now respiratory is very much on board with us. They have been given some new CPAP masks that don't ride on the bridge of that nose. So if you have any question, by all means, get a hold of respiratory and wound care, and let's see if there's something that we can better fit our patients so that they don't develop a pressure injury related to a device. When consult wound care for staging of pressure injuries. Again, all other wounds are partial thickness or full thickness. So again, the pressure is going to be on that bony prominence. How do you consult us? Go into Epic. You have to use the verbiage, wound, ostomy, eval, and treat. If you put change dressing, apply dressing, change dressing, those won't come to us. So please put in the correct verbiage of wound, ostomy, eval, and treat. And then that will come to us. We always are constantly checking the computer for consults. And when you send us a consult, if you could, tell us what and why we're seeing the patient. Prevention. I know all of us are doing that. We're very diligent bedside staff, turning our patients every 2 hours, floating our heels, managing the moisture by changing the brief, changing that underpad, use a seat cushion when they are up in the chair, routinely applying Mepilex to their sacrum, to their heels. All of those things are bedside driven. You do not need wound care. You guys have the power in your hands to go ahead and implement all of those prevention measures. Mepilex. Erlanger has invested in the Mepilex Corporation. We have a great relationship with them. They have some awesome products. So we're looking at the sacrum. The sacrum and the heel have both been reformulated. They have nice little tabs on them. You'll see where you can peel them back to check them every shift. The heel ones you'll see there, the larger winged areas go over the malleoli, and then the more narrow strip comes up and over the base of the heel and then folds back over the malleoli. Sacrum dressing, change it every 3 days or more often. If soiling, the heel dressing, change every 5 days or more often if it becomes dislodged. A little tip we've learned that if they're wearing the heel Mepilexes, if you put on the little slipper socks, it helps those Mepilexes stay in place a little longer. Prevention supplies that we have here available in materials management are a turning wedge. And to order one, you type in a liner, body disposable, heel lift boots, boot and guardian, and then a seat cushion/soft care. So again, all of those are available in materials, and they can all be ordered. You do not need wound care for that. You guys have the power to do that. Specialty beds. We're very fortunate here at Erlanger to have many specialty beds. This particular one is a wound care bed, and you'll know that because there will be marking at the foot or at the side that says a wound care bed. So it improves the pressure distribution, helps with the microclimate. We want those for patients that have severe wounds. They do have a 500-pound weight limit. You order those by the e-chart, unit manager, and equipment transport. Further on with our specialty beds, we have a bariatric bed and a low air loss bed. And the bariatric beds are for weight up to 1,000 pounds. Again, ordering them the same way. The specialty bed Clinitron has to be ordered. It's an air fluidized for someone that comes in that has multiple wounds on many pressure points. And you will need to consult us for us to come in and make an assessment or to discuss the patient's needs with you over the phone, and then we can order the Clinitron bed. It is a rental. Negative pressure wound therapy. You'll never have to put them on. You may have to take them off. So you document in the flow sheet. You need to chart what device it is, the drainage, the status. So you'll look there and you see that black. That is the black foam dressing, and when you look at that, what you see now is totally collapsed, meaning that the suction is in place. If it is not in place, then that black foam will rehydrate and it will become foamy and spongy. We do want the bedside nurse to monitor and troubleshoot any alarms. Contact the managing service. We don't manage all wound vacs. A lot of times it's plastics or surgery or ortho. And by all means, if you cannot get a seal within 2 hours, again, get a hold of the managing service. It would need to be removed and a normal saline dressing applied. Because what will happen is if we cannot maintain a seal, the fluid will rehydrate that foam, and then the fluid will just be sitting there bathing that wound, which could cause deterioration of that wound. Let's talk about ostomies. That's another service that Erlanger offers here under the Inpatient Wound Care Department. So we're looking at ileostomies and colostomies. If I can just give one caveat here is that when you have an ileostomy or colostomy person, please just be mindful of how you come into the room and how you respond to their ostomy. It is a life-changing event for them, so they're watching your responses, and let's just be mindful of that. The ileostomy is typically on the right-hand side of the body. It involves the small bowel. It's more liquid stool and a high output. High output. Colostomy, typically going to be on the left-hand side of the body or in the center of the abdomen, involves the large bowel. It's a more predictable stool. It's a more formed type of stool with no dietary restrictions there. Bedside staff is expected for routine care, and routine care is emptying that pouch when it's 1/3 full, changing the entire appliance every 3 to 4 days, or any time that the pouch is leaking. And by all means, if you have any concerns or questions, please get a hold of Inpatient Ostomy, and we will come and help you. Urostomy is where they use a piece of the small bowel. They put the ureters in there, and then they make a stoma to the outside, so then urine can drain out. And that is typically on the right-hand side of the body. So Ostomy Basics, you want to clean and dry the skin, warm tap water, no soap, no baby wipes. You want to cut the new pouch to be where you can see 1/8 of skin all around the stoma. Call the ostomy nurse. Call us if you have any problems with difficulties with supply questions or skin irritation, or you just want another hand to do it. We understand that not everybody knows how to take care of ostomies or to empty the pouches. So again, we want to come alongside of you, and we want to work with you on that so that you feel more comfortable with that. Wound champions. We are always looking for some wound champions. One of the nice things is that we take you under our wing. We will train you. You can be the expert for your unit. Someone has a question or a concern. We're encouraging PCTs, encouraging RNs, LPNs to be skincare champions. 4 times a year, Erlanger performs an audit. We're due to have that here in October. And we definitely utilize all of our bedside wound champions to assist in that. Again, you will be the unit expert, attend quarterly meetings, and you will have one-on-one training with the wound care staff. Thank you for your time. Thank you again for being part of Erlanger. Again, how to get a hold of us is to page us at 1205, or you can leave a message at 7032, or you can consult us. Thank you very much.